Omicron is here, and it is poised to hit Oregon hard. That was the message delivered at a Friday news conference led by Governor Kate Brown.
We only have a few weeks to prepare before Omicron hits our communities and healthcare systems in full force.
The governor noted that it was a year ago this week that COVID vaccines were first administered here. And a year later, we face a second holiday season with the virus surging. OHSU's chief COVID forecaster expects we will follow countries like the UK and Denmark and see Omicron cases double every 2 or 3 days, quickly overtaking Delta as the dominant variant.
We can expect a surge in Oregon hospitalizations by mid-January, with infections that begin sooner than that. Combined with its heightened transmissibility, we expect Omicron will generate a large increase in the number of Oregonians who will become severely ill and likely need a hospital bed.
Dr. Graven did say that while Omicron may be the most transmissible yet, it does not appear to be as deadly as Delta. But just by sheer speed and volume, it will be hard to handle.
The OHSU forecast is telling us that a big wave is coming, and it threatens to be bigger than any wave we've seen before.
At its worst, Omicron could cause more than 3,000 to be hospitalized in Oregon at a peak in early February, compared to Delta's peak of 1,200 last September. But with a push of people getting vaccinated and boosted, the Omicron hospital surge could be closer to 2,000. That's why Oregon will focus on boosting the elderly and most vulnerable, and then move to get 1 million boosted in January.
The science and data are clear. Vaccinations are the strongest line of defense we have against COVID-19. And the preliminary research shows boosters provide a critical layer of protection against the Omicron variant.
Any way Oregonians can help themselves will help their communities and an exhausted healthcare system that is still short on hospital beds and staff dealing with the Delta variant.
To be candid, this feels like another gut punch, particularly for healthcare workers who've been stretched truly beyond their limits.
Tim Gordon, KGW News.